Hello everyone, my name is Michael Phillip, your physical therapist, and today's video topic is runner's knee. What is runner's knee, you ask? Well, if you're an avid runner who competes regularly in 5Ks, 10Ks, triathlons, or marathons, you've probably run into this term runner's knee. Hopefully, it's at least another runner complaining about it rather than hearing it from your doctor's mouth. But in either case, you should know about it. Runner's knee is medically known as patellofemoral pain syndrome, or PFPS. It is a condition where the undersurface of your kneecap rubs against your femur, causing irritation, inflammation, and pain. The pain can either be a sharp occasional twinge of pain or a constant dull ache that typically progresses the more you run, but also has been known to progress and come and go as you run. What is the cause of runner's knee? Well, as you walk or run, your patella glides up and down in a groove in your femur as your thigh muscles contract and relax. Where the problem lies is when it does not track correctly in the middle of this groove. This can occur due to several reasons, which can kind of be hard to determine on your own. And finding the right cause will help eliminate the symptoms and prevent further wearing in your kneecap. However, some of the most common reasons are weakness in your quadriceps muscle, specifically your VMO or vastus medialis oblique. Weakness in your gluteus medius. This is a muscle in your buttocks that controls the stability of the hip and knee when you're in a stance phase. Biomechanical faults in your hip and knee or ankle. Your foot and ankle have a lot of control in what forces are placed on the knee joint. For example, if you have flat feet that pronate, your knee will tend to have greater stresses placed on the inside versus the outside. If patella has bone spurs, is tilted, or is sitting too high in your femoral groove, you can get excessive wearing and tearing of the kneecap that way. Your hip joint angles also can affect your knee. If your hip is rotated inwards or outwards, it can affect the placement of the kneecap in that femoral groove. Past injuries and current structure of the knee can also play a role in the development of runner's knee. If you have damaged the cartilage of your knee or your kneecap in the past, you may likely be suffering from it now. You have a certain level of cartilage to cushion and protect your knee. And if this is worn out over the years, then you may be developing early arthritis, which can lead to patellofemoral pain. Then there is also muscular tightness. Tightness in your quads, hamstrings, or calf muscles can place forces on your kneecap that can pull it to one side or the other. Those muscles all affect the knee joint, and an imbalance and inflexibility over time can cause increased pressures on the knee and cause the kneecap to track more medial or laterally in that femoral groove. So, what can you do to prevent runner's knee? Staying strong and flexible can be key to keeping this painful condition at bay. Your body loves to be symmetrical and balanced, and when one side is weaker or less flexible than the other, it will throw the whole chain off, which can affect you anywhere from your spine down to your feet. So you need to be performing strengthening and stretching exercises regularly that not only improves the muscles you think will help you, but also those that you may not even know about. If you think you have runner's knee, you need to see a physical therapist. He or she will provide a complete assessment of your entire kinetic chain from your back down to your feet to truly find out what has caused this runner's knee. And what they'll do is they'll guide you through a treatment program to get you back to running pain-free. I hope this video was informative and can help you or somebody you know prevent or reduce the amount of knee pain they have when they run. If not, check with your physical therapist. Most likely, they're going to be the ones that'll get you back on track. Till next time.